Hello, how y'all doing today? This is Dr. Nicole Brown. We are coming to you from the Nurse Doll studio. How's everyone doing out there today? I know it's been a while. I have missed you guys. Um, we are having our April 2025 Nurse Talk. We received some new orders for the Nurse Doll, so thank you very much. We're going through a transitional phase. And making sure our website is up to date and up to par with the standards that it needs to be. So we got our website back up and running. We're getting ready for our new season, which is Nurses Week coming up, Nurses Month. And also, we have so many nursing graduations. So, if you have a nurse in your life who you want to honor, please, think about the nurse dolls. Having a nurse doll is a great way of honoring someone who is going to nursing school. And also, we can do customized badges for our nurse dolls. We have our nurse Nicole doll, our nurse Linda doll. So, and then we can do customized badges. Hey, Audrey, how you doing? Hey, Dina. Hey, Karen. Hi, Denise. Hi, Monica. Thanks for tuning in today. Joanna, Miss Velma, Anna, Nicole, and Phyllis. How are y'all doing today on this fine Sunday? We just want to talk about some of the topics in nursing and just, take a few minutes to start talking and thinking about some things. I have my host, Corey. How you doing? Yes, and Nurses Month. I'm a nurse. I celebrate every day. Now, also, during Nurses Week, I will also be doing a day. We will be celebrating our nursing history and also Mary Eliza Mahoney, our first African American nurse. Her birthday is May the 7th, so we'll be honoring her. And also our first nurse statistic collector, and that will be our Florence Nightingale. We'll be celebrating her on May the 12th. So we got a lot of fun things coming out. And I know some of y'all might have missed my whole week of nursing information. And of course, I'm going to replay that again this year. We got, so we're going to do that over again this coming year because we're going to promote nursing no matter where we go. Also in May, we have my 31st year anniversary of nursing coming up. So of course, I got to celebrate in style with that. so just letting you know some of the things that we'll be doing for Nurses Week. And also I'll be having some kind of activity, either a paint party. I don't know how many people are going to be there. It might just be me and some wine, painting and wine with me. Or I might have some special guests in the audience with us for nurses, for, celebrating our Nurses Week. So just some fun activities that are coming up. And also be announcing some freebies that are out in the community for nurses because we need our freebies. Our free donuts, our free ice cream, our free coffee. We're going to need a coffee break all the time. So I'll be announcing some of those things. All right, Corey, go ahead. What are some questions you want us to talk about today? I love that. I love hearing that story. And thank you so much for bringing it to my attention. There's a hospital that requires all of their new doctors to do a rotation shift with a nurse. And I mean, I think that they're learning a lot of information, and it's very helpful. They were saying that doctors were learning how to put patients on a monitor, also learning how to do an EKG because they order EKG. So it's good to know how to put the client on an EKG. Drawing blood, that is a skill. Oh my gosh, drawing blood is a skill. Even learning how to send it off to lab properly, and also starting IVs. Oh my gosh, that is something major that I love it when doctors are doing those things. Also, doing a straight catheter, that's putting a tube in the bladder, getting out urine, and a lot of doctors order those, so they need to know how it is on the other end, how to collect it, how the patient is responding, and also learning how to prevent falls, because she had a lot of patients who were on a fall risk protocol, and also how to assist clients who keep getting out of the bed when they're not supposed to. How do you address those issues? A lot of places have patients who are, what is it, medically restrained, which they give them medicines so they don't get out of the bed. But we also need to understand, why is that important? Why are these things being done? So some of those things you need to look into to see what's going on. And maybe they're learning some different things. And this doctor was out with a registered nurse, so she really appreciated that experience. And I think that it's a good thing. Also, I, as a nurse, would love to have spend a day with a physician and just see what they do. I think that that might be something that should be also required, that nurses and doctors, sh- shadow each other. I think that that is a very good experience. Okay. Now, when we start out as nurses, you are most of the time in most hospitals, a lot of places do encourage you to be a CNA first or be a nurse aide. In a hospital, when I first became a nurse back in 1994, we had to spend a whole week with the CNA, but I was working on that floor, so I already knew what the CNAs did. Then I had to spend a week with the LPNs. The LPNs started all the IVs on the floor, so we had to go around. That's how we got our IV skills, learning how to draw blood and starting IVs, IV lines. So that's a specialty in itself. And then we, of course, shadowed the registered nurse for I think about 3 to 4 weeks. Then we also had to shadow the secretary. Back in the old days, we had a secretary. That's before we had everything computerized, where we had to sit down together and decide, what did Dr. X, Y, and Z write? And what is he meaning? So everybody had to learn the doctor's handwriting. But luckily, nowadays, you don't have to do that. Everything is computerized. So I don't know I think they do have secretaries working certain shifts, but it's not 24 hours like we had secretaries 24 hours back in the olden days. So I love that. I love that concept. It's so exciting. All this learning is going on. That's really good information. All right. So what else did you learn, Corey? Well, I think that that's very important, that you have a bill that's passed that an administrator of a hospital and or nursing home facility has to be licensed. That means that we have to have some accountability, because they need to understand nurse patient ratios, which is the major problem while we're having all of these accidents and injuries with our clients, because the people who are making the decisions and the higher ups do not understand the ramifications of these decisions. Also, cutting staff pay, cutting staff benefits, all of these. A administrator who is licensed should have some background and some training on what to do. Now, here in Virginia, we have it's already a requirement for a hospital administrator or nursing home administrator to have a license. And here are the details. I'm going to break it down. They have to have education and training. They need to have at least a bachelor's degree in a related field, such as health administration, nursing, or a related field, social work. Also, administering training, that's a AIT program that involves over 2,000 hours of training in a licensed nursing facility. and it must be completed within 24 months. In addition to that, they have to have a preceptor who will supervise them um, in all of this training. So that's really good that they have this training. And also in Virginia, they have to have licensing. They have to pass the national exam, which is called the National Association of Long-Term Care Administrator Boards. So they have to pass that exam. They also have to apply for a license for the Board of Long-Term Care Administration, pay fees, and provide the documentation. And they have to have licensure assurance, which means they have to be approved by the board. Now, my other question is, do they have to have insurance? Because a lot of nurses have to have insurance, doctors have to have insurance, malpractice insurance. So that might be something we need to look into also. And then they have to have continuing education. Nursing home administrators in the state of Virginia have to have continuing education credits to maintain their licensure. Now, here in Virginia, nurses and physicians also have to have continuing education. That means they're going to learn how to do things better, learn about any new advances there are in technology or in their practice. So that's very important. And that can also help, especially in these nursing homes where the administrator has to understand their role and the rules that they're making and that what they vote for and against and how that relates to patient care. And you have to have some type of formal education to understand that, your decisions as a healthcare administrator can have a drastic impact, whether good or bad, on patient care. So we need to make sure they are aware of those things. And that's so exciting. So I'm excited for Connecticut. I hope they pass that bill number 7, which means administrators need to be licensed. They have to be educated and licensed. What else did you learn new out there in these healthcare streets, Corey? It is hard out in these nursing streets, but I definitely will say nursing is a rewarding career, but it comes with many ups and downs, just like any other career. And you have to be aware that there may be some things that you have to educate yourself on to be successful and overcome these obstacles. I have been a new nurse and a young nurse, and I've had a lot of people threatening. So, I'm going to call the board of nursing on you. Well, you have to have a criteria. They can call the board of nursing all they want. They have to know your name, your address, your social. They have to know your license number. They have to write documentation up that says that there is a problem and what the problem is and how that problem has affected patient care. So you have to have, and it's a criteria. I think it's six criteria you have to meet to be actually have an issue with the board of nursing. Because I've had people say that to me also. But you have to also know your laws and always have your own malpractice insurance. It's only get it every year. Do not take any chances out here in these healthcare streets. You need to have your practice license insurance every year. And also, there are different forms of bullying. You can have bullying by patient family members. They'll be trying to bully you. I mean, I've had family members, attack me and patients, so you can have that from that standpoint. You can have also physicians bullying you, going, I want these orders done now, but this does not meet the requirements. This is not within my standard of practice. So I'm going to have to deny that. Also, nurse managers can also be bullies, especially with time. They're, denying your vacation time, your request. threatening to fire you if you call off during holidays, and also supervisors of the hospital not letting you leave on time. You may have your relief coming in, but they might be short staffed on another floor, and they might want you to float and stay an extra 4 hours while they find somebody else on another floor. And you have to start sticking up and standing up, for yourself and saying, no, I cannot stay here today. I'm clocking out and I'm walking out, and I'm giving a report to the person who's coming on for my shift, but I will not be taking anyone else's clients for right now. Each floor has a nurse manager, and that nurse manager is on call, and the charge nurse is on call. So we have some things to do. Also, I want to talk about nursing academia. When you're teaching nursing school, I mean, I've had faculty members with the bullying. I mean, it just goes all over, where so many people can bully you. But you have to know your laws. You have to know when you're in the right, and you have to be tactful with these people and say, I'm not going to stand for this. So it's just a lot of different things that you may encounter, but you can have that on any job. Bullying, and especially in corporate America. And a lot of times bullying can come in a form of passive aggressive behavior. You're doing something wrong and they're not even talking to you, or you're doing something right, but they're saying it's wrong. So it can come in all forms. So you just have to be aware of what you're doing and know your rights, and try to have someone that you can talk to about those issues. And if all also reach out to HR. If you're having a problem, definitely reach out to HR and document these things are happening. That's very important. Go ahead, Corey. Yes. Well, nursing can be dangerous, just like other professions, they can be dangerous too, but you have to be aware of what's going on. Now, I have worked in the most dangerous area in the hospital, the emergency room, 10 years. And I will definitely say I have experienced my share of beat downs on the job. I've had patients push me, I've had patients knock me down, I've had family members knock me down. I've had patients kick me in my stomach with two of my three children while I'm like 6 months pregnant. And that was in the emergency room. And I was like, maybe that might not be the place for me to be while I'm pregnant. But I've had patients, I used to wear those little badges with the reel, and I've had someone try to choke me. I only took them 2 times to do that. And I realized I need the badge that just clips on, no reels that you can pull down and forth. Because in an emergency room, that's very, very dangerous. So you have to start talking to people about, how to avoid dangers in emergencies, some things that you may encounter, and how can you can overcome those things. And also, yes, I've been injured in the emergency room, and I've had people, come to me and go, how do you think you could have avoided that? Instead of going, this person should have never, done these things to you. And you may need to talk to them straight on and say, maybe you might want to look at, how this person was wrong and things could have been improved upon. So, these are things that you have to look into. And also realize that you may have to change a job. If you're in a place where you feel unsafe and you don't have the support of the management, you may have to change jobs, and they may have to have a few people walk away from that job so they will know that, people are saying constantly, this is unsafe. We're not supporting them. And, they will start thinking, maybe there's a problem here. Maybe we need to start changing up in the way that we're responding to the staff. Because, this is coming up my 31st year. I have worked floor nursing. I did 10 years in the emergency room, and I always worked a part-time job. I taught nursing school for 10 years. And then my last corporate job, I did Medicaid for almost 10 years. So, and that's before I went into nurse entrepreneurship. So those can be some dangerous things that you will encounter. And also I do home care, and that can be very dangerous because you have to also understand that you have to be aware of your surroundings. I was just talking to one of my aides this morning, and she was saying she's not going back because the client has an animal out. They have a German Shepherd who is huge. We're talking this huge dog. And I know I've gone to their house and I'm like, I don't, when I go to someone's house and I knock on the door, I'm holding the doorknob. Excuse me, do you have a pet? And can you put it up? Because I'm not stepping in with a pet. Then also you have to ask who else is in the house. Are you safe? Do you feel safe? Is this person safe? So a lot of things that you can encounter, because the emergency room is going to be the most dangerous place in the hospital. But in home health, you have so many different elements of safety. Also, driving. When I used to work for Medicaid, I did home health, and I'm like, just me driving, and I'm driving an hour to an hour and a half to visit a client. For me to get there safely, please give me, some praise for just getting to my job safely, driving there, because it's been dangerous. And then some of my clients lived out in the woods, and I would get out and go to someone's house, and I'm like, I feel strange out here. What's going on? And I'd go inside, and I'll be like, every time I'm outside and when I come visit you, I always feel like someone's watching me, and it's nothing but woods. And they're like, oh yes, it's a family of bears behind us. It's like a mom bear and her 2 or 3 cubs. They're probably out there, but they're harmless. They haven't come out to bother anyone before. So, and then, like I said, with also animals, chickens, snakes, ferrets, rats. When you go to people's houses, roaches. If you have asthma, you have to be aware of what's going on. Do these people have these little animals that can be harmful to you? So those are a lot. You have to ask some of those questions and do a further investigation. But home care can definitely be very dangerous. And also different types of homes that you're visiting, especially mental health clients. In a lot of places, people have sex offender homes. That's big in the group home industry. And sometimes you have nurses who have to go out and do an assessment on these clients, but they have to also know about safety. If I were a female, well, I am a female, but if I were going to someone and to see someone and they're a sex offender and they're living in a home, they probably are living in a home where there are other sex offenders. So as a female, I would not go in that home by myself. I may knock on the door and ask that client to come outside, or ask them to meet me at my car, and I can do my assessment, at my car window. And I've done that before, especially during COVID. When I had to go visit people, I wouldn't go into their house. I would have them come to the door and we would talk at the door. So sometimes you have to, look at your area and see how you can maintain your safety. Now, back to hospitals, like I said, I have been injured and knocked down by, I've had a doctor hit me. I've had a couple of doctors have hit me. I've had patients hit me and family members hit me. And I have to be aware of my surroundings. And I also, if I feel unsafe, I need to ask a coworker to go with me. I've had some issues, especially when you've had an emergency room, you had a code, and you have to go and tell the family members that the patient has died. Well, that can be a very volatile situation in seconds. And we've had to call sometimes, especially when it's a room of 30 people, you might want to call security to go with you just to be on the safe side, because it can go from 0 to 360 in seconds, and it may not turn out good for you. I've seen patients and their family members beat and swing on a doctor also. Sometimes we have to get in between the doctor and the family or the patient, so no one can get injured. So it's a lot of things that can go on in a hospital. You got to be alert and aware of your surroundings, and also document and report. Those things are very important that you're going to have to do. Okay. But nursing is a wonderful profession. It is needed. We need more nurses, and we just got to keep our nurses safe, and we got to start teaching them about safety. Now, by me having taught nursing for 10 years, I don't know where in a curriculum I could have added safety as a topic, a daily topic. Or I could have brought in some newspaper articles and gave some scenarios or what have you. Now, in a baccalaureate program, you may have more time to bring in more safety measures and talk to them. But in associates, it's kind of tight. Now, when we have to take our clients or our students to a psych hospital, we definitely talk about safety there, because that is a definite mental health component that I would add into my class when we're having to go out to do our clinicals with our mental health clients, because we're locked in on a mental health ward. And we have clients who are walking around, who are pacing, who are talking to themselves, who may be getting agitated, who are fighting in the corner amongst themselves, or even fighting or punching the walls, punching. Sometimes they've gotten into a fight with the staff there. And, I have to get my students out. We also have to always remember, when we go into mental health, we have to stay at the door. When you go to someone's room in mental health, you stand at the door. You do not go all the way in the room and give them an opportunity to barricade you in there. You have to be aware of your surroundings. So those are some of the things that you have to be aware of. And like I said, I've had some injuries, especially back injuries. Someone pushing me down, patients pushing me down, doctors pushing me down, and those reels, I never wear those. I had someone swing on me, swinging around my neck. The second time, took one more time, and I said I will never wear those reels again because they're too dangerous. I only have a little clip-on badge. I will never do a reel again. It's too dangerous. So those are some of the things that you want to think about when you're in nursing. Your safety. And like I said, I do home care. I go out, and I definitely want to be safe and avoid pets and also other family members, because they may have you have to ask them, do you have a gun in the home? Are you using the gun? How about any knives? Is there anyone here who's hurting you? Do you feel you might want to hurt someone? So those are some of the things you have to start talking about. And also reading up about safety practices. And maybe we want to add safety practices for nurses in every section in nursing school. I haven't taught nursing school in a few years, but I think that, now that you've brought that up to my attention, we need to start bringing these current events, talking about what's going on with nurses and how nurses are being injured. In some ways we can avoid it, and some ways, how do we report when we're feeling like we're afraid and someone may be, injuring us or could have the potential to injure us. So I hope I answered that question. Okay. Yes, correct. And I want to thank everyone. Your nurse Bay. Hey girl, how you doing? Love to thank you for responding and thank you for supporting me. I have so many people. We're live on Facebook, TikTok, Instagram. We're also doing our StreamYard. So we'll be able to share all of this with other people. And we want to definitely talk about positive things in nursing. We need more nurses. And we have nursing graduation coming up. Also, some nurses are retiring. So share the nurse dolls with them. Okay. They come with a free book with each doll purchase. So we need more nurses. So let's promote them. All righty. Well, thank y'all so much for tuning in. You all have a great day. And I'll see you next time. Okay. Thank you. Thank y'all so much for tuning in.